In this video, I'm going to show you how the Graston technique works for tennis elbow. We'll talk about whether or not it's worth trying out. So Graston that like button and let's get started. The Graston technique is a form of instrument-assisted soft tissue mobilization. It uses a set of stainless steel tools. These are two from the set. They have curved edges and they're designed to increase range of motion at joints and to release tightness in tissues. And I'm also going to touch on some of the side effects that might show up after treatment, such as light bruising and redness. Graston technique can help relieve the pain from common conditions such as tennis elbow, swimmer shoulder, plantar fasciitis. And here's a more specific definition of the Graston technique from physiopedia.com. There's been some research done about instrument-assisted soft tissue mobilization in general, but today I wanted to highlight one study where they looked at the Graston technique in terms of treating patients who had tennis elbow. A study done in 2017 where they looked at a group of patients with lateral epicondylitis or tennis elbow, and in a 6-week period, not only did they have less pain, they also had better grip strength and increased proprioception, that is, increased sense of where their joints are in space. I want to touch quickly on the side effects of Graston. So it can occasionally leave little tiny red dots called petechiae in the area that we're working, and it can sometimes leave light bruising. But I want to highlight that you should not be seeing results like this. And close your eyes if you're squeamish, but things like this, these are shown on the internet, these are highlighted in social media. People have it in their heads based on seeing these images that this is what the Graston technique may look like on them, and that should not be the case. This is taken too far. These treatments are likely by an inexperienced practitioner who does not understand tissue tolerance. So you can open your eyes again if you're squeamish. There's no point in stirring up local inflammation to that level. Sure, we may get some local inflammatory response, and that's necessary as tissues break down and remodel. I would never leave one of my patients looking like that, and it drives me crazy to see this on social media because that is not the norm. So when you go in to get a Graston treatment, you can expect maybe some discomfort in the area that we're working on, but you should not be feeling sharp pain the whole time. You should not be clenching. You should not be holding your breath. It should not be this terrible experience. It doesn't have to look like that. So yes, Graston works great at treating the pain of tennis elbow, but I have to mention, if we're just doing Graston treatments and nothing else, it's kind of like we're just putting out fires. You go and play tennis or do your keyboard warrior activity, whatever it is that's flaring this up, we can go and Graston this, and then you're going to feel better and you're going to think it's gone and it's going to come right back. But if we want a long-term solution, we're going to be needing to look at a few things such as eccentric exercise, joint adjusting in nearby areas, manual therapy on related areas, and different taping, bracing, and management strategies. If you found this video helpful, you can find more information about the Graston technique on our website. You can also subscribe to our channel right over here, and there's another video that you might be interested in right here as well. All right, thank you for watching. We'll see you on the next one.